couple of seconds time, so just bear with me. I'm starting now. Oh, you're live now, Councillor Ward.
Thank you very much, and welcome everyone who's joining this meeting of the Shardane Ward Committee, or Shardane Ward Forum I should say, on the virtual format. It's the first time we've tried this in Shardane, so hopefully all will go well. I'm joined this evening by Elizabeth Griffiths, who is the Assistant Director of Public Health, and will talk shortly about the COVID-19 situation in Birmingham and give us all an update on where we are with all of that. And also by Kevin Gibbon, whose job title I'm not entirely certain of, but he's here to talk to us about highways issues. So we're going to start off by referring to the agenda. And the first thing I have to tell everybody about is notice of recording, that any resident listening or participating in this online meeting, the recording of the meeting is being taken. It will be available as a future record of this meeting. Also, if you want to take any photos of the screen, you are free to do so. And if you wish to record at the meeting, you're also free to do so. And with that, I'll move straight into item 2, which is the COVID-19 update. And I'm going to pass over to Elizabeth Griffiths, the Assistant Director of Public Health, who's going to give us the numbers on where we are with the pandemic and talk to us about the current lockdown situation, the rules and restrictions. Elizabeth.
Thank you, Councillor Ward, and thank you everyone here for inviting me over today. So as Councillor Ward has just said, I'll talk to you about, I'll set out some of the context around COVID, so a little bit about where we've been, what the testing arrangements are, what you can do to reduce your own risk of catching COVID or becoming very unwell if you did catch COVID, a little bit around vaccination and where we're going next. So as you know, with COVID, I just want to stress that this is a really new and novel virus. It first appeared in the world in December 2019, so still a relatively new organism, and spread through into the UK around February. It didn't actually hit Birmingham until the second week in March. So just within that 7-month period, we've seen this change. So in terms of that, we saw a rapid rise towards the end of March into our first peak in the end of April, and then numbers started to settle down while we were in lockdown. June and July, we had relatively low numbers, but then it's worth noting that we didn't actually have such robust testing arrangements back then. We've since then seen cases start to creep up, and we saw our first large peak in August, and that's where it saw us go into enhanced support. And then as we continue to rise, we moved into an area of national intervention. So that's where we started to get the restrictions of people not going into private houses or gardens. And then moved into tier 2, and now we see ourselves in the national lockdown for the next 3 weeks, I think we have left on this. In terms of Birmingham, what we've seen in cases is a rise in the rates across the city, and we're seeing that pretty much in every ward. The numbers are going up. Week by week, I get a list of the wards that have the highest rates, and it fluctuates, if I'm honest. You do get different names in there, but in general, for the whole city, we are seeing an increase in cases. What we're seeing in Birmingham compared to other areas is that the rise in our rates is at a much slower rate. We're currently around 290 per 100,000 in terms of our rate of cases. We were about 260 last week, so that shows you the increase that we're seeing. We're not having the level of exponential or really big growth in numbers that some other areas have seen. So, for example, Manchester went from around 60 per 100,000 right up to 500 per 100,000. So just to give you an example of the differences in how quickly we're getting there. That's not to say that, you know, cases are still going up. This is still an issue. We're around 290 at the moment. Our testing has increased. we'd managed to get our testing up quite a lot, but in the last month, I think our test rate has started to go down. The proportion of tests that are coming back as positive is around 15% now. So 15% of cases of tests that are taken are coming back with a positive result. As I say, again, slightly lower than some of the other areas, but our slow increase, we're very sure is down because of our hard work and your hard work, the work that everyone in the city is doing, and particularly the simple things that we can all do, such as covering our face when we're wearing masks, when we're out in public, washing our hands regularly, not touching your face, keeping distance. So all those messaging again. In terms of detail for Shard End, your ward is currently ranking 47th out of the 69 wards in terms of the number of COVID cases that you're seeing. So that's where the first is the highest and the 69th is the lowest. So you're actually quite below average in terms of the number of rates for the city. And if you look at the profile of cases that we're seeing in your ward, it's a slightly younger population that are starting to get COVID. We also are seeing slightly more in the 60 to 79-year-olds than the average for Birmingham, and slightly less in the much younger population, so less cases in our 0 to 19-year-olds. So in terms of, I'll just talk you through testing options, if that would help, Councillor Ward, just to go through what we have. So in general, there are two different ways, types of testing. The first one's an antigen test, and this is a swab. So this is a really long swab that you take through up your nose and in your throat. And this is the most accurate swab to say that you've got coronavirus at that time of taking that test. So if you have coronavirus on the day of the test, it will tell you that. What it won't tell you, you could get coronavirus tomorrow and it won't be able to tell you that. So it's accurate on the day that you take the test. You order that test if you've got any of the three main symptoms. So if you've got high temperature, persistent cough, loss of smell or taste, and you can order that by ringing 119 or through the NHS website. And then there's a variety of testing options that you can do, whether that's a drive-in, a walk-in, or by ordering a postal kit to do it yourself. In Birmingham, we're quite well provided for in terms of testing provision. We've got a couple of drive-ins. There's one out by the airport, there's one Reservoir Road, there's one that's a rotational one. We've got about 9 walk-in centres, and are constantly pushing for more. There's plenty of appointments available, so please do, if you are experiencing any of those symptoms, book a test. I think, as I mentioned, we have seen a reduction in the test take-up recently, and I think this is the same as the national picture, apathy potentially. So really keen to push for people to access testing results where they can, so that we can then take actions like making sure that people are isolating and not passing on that spread to our loved ones. The other type of test that you can do is an antibody test, and this is a blood test to see if you've had COVID. This at the moment is generally available for research purposes or for people employed by the NHS and social care. This is the one that you can get privately. I think it's about £150, not really recommended because it's, I think, in general, not everyone in the population develops antibodies, so they wouldn't be able to pick it up in those cases. And you're certain about a third of the population can shed those antibodies quite quickly, so wouldn't hold on to that result for a long time. So really, don't waste your money on this. Please access the tests should you have symptoms. And then the other thing that I want to tell you about is all very new, and this is around a lateral flow test, which is a bit like a pregnancy test, where you can get a result back in about half an hour. So we're currently working through how we can roll that out, and that will be open to the general population that aren't symptomatic, so asymptomatic population. So we're just working through what that can look like in Birmingham and how we can get that to you as quickly as possible. In terms of what you can do to reduce the risk of getting COVID and of getting very bad symptoms from COVID should you get it, there are 6 risk factors really, and 3 of them you can't do anything about, and 3 of them you can. So the things you can't do much about are your age. Unfortunately, we're stuck with that one. People that are over 80 are most vulnerable to getting worse symptoms from COVID. If you're a man, men are more likely to be unwell from COVID. And around ethnicity, it's shown that the population, that the not white population, are the ones that are more likely to get an adverse reaction from or more illness from COVID. This is linked to the 3 things that you can do something about, because these are more prevalent, more likely to see these things in that population. So these are things like smoking. You can quit smoking, and that will certainly reduce your risk of having an adverse reaction from COVID. We know that smoking does things to your lungs. This affects your lungs. So if you can stop smoking, that will stop you being more at risk of having a worse outcome. There's lots of support available. You can access support through your pharmacist. There's lots of apps out there. You could switch to vaping. Another thing that you can do to change to reduce your risk is to lose weight. Just very small changes in your diet can help reduce some of those risk factors. And also getting better control of chronic diseases, so things like diabetes, managing those more effectively through your diet, through other means, help to reduce the risk. So if any of these things that you would like to do, please reach out to your GP practice. They're very happy to help. We've also got some resources through our Be Healthy programme at the council to help support people there. So all those things will really help. Vaccines, I can't not mention vaccines. So I'm sure you've seen in the news that there's been some results through just recently on one of the front runners for the vaccine. So just to say that's all wonderfully positive, very excited about that. There are still some safety tests that need to be done around that, because vaccines in general have to go through quite a lengthy process to get to the point where they've been designed and then to the point where are available to the public. So these are things like, do they work in the lab? Do they work when they're in humans? Do they work in different humans? Is it safe? How long does it work for? And all of these things, as you can imagine, take a very long time to develop and then to be processed. So we're at the point where this vaccine is looking very positive. We still need to do more tests on the safety of that. And then, of course, working out, the NHS is currently working out how they can roll that out to get to the population. Still working that up. I think we're likely to see that that's going to be prioritised first to the NHS, and then people very similar to flu, so those people that are more vulnerable by their health conditions, before we then see it move out to the general population.
Thanks, Elizabeth. If anybody in the meeting does want to ask Elizabeth a question, do please type your question into the Q&A. Somebody called Genius has already put a couple of questions in there. I'll take them in the reverse order. The second question being asked was, do you think COVID-19 situation will have an impact on the Commonwealth Games, and what steps have been taken, if any, can be taken to minimise the effects? Well, of course, most immediately, the pandemic has had an impact on the capital programmes that we're having to deliver in support of the Commonwealth Games, and there are 3 principal capital schemes: the building of a games village, the building of a stadium, and the building of the aquatic centre. With the stadium and the aquatic centre, they're both on course to be delivered in time for the Games. So we're working on the anticipation that will actually happen, and they won't have that impact on the Games of not providing the facilities. Unfortunately, with the Games Village, because of delays that have come about through the pandemic, it's now not going to be possible to deliver the village in time for the Games. So other arrangements have been made for the athletes and officials arriving for the games themselves in 2022. They'll now be accommodated at the University of Birmingham, Warwick University, and the hotels at the National Exhibition Centre. Having said that, the village still will be built, so we'll still get those near 2,000 new homes for the city as a legacy from the games, and those homes will be a catalyst for a further 3,000 new homes that will be built in the immediate vicinity in Perry Bar. So we'll still deliver the legacies from the games. It's just that one change, that the athletes and officials will be accommodated elsewhere. In terms of the event in the summer of 2022, it is, I think, very difficult to see how such a large multi-sporting event could be delivered if the pandemic is still with us in the way that you would ordinarily expect, i.e. with lots of people turning up to watch the events, a real celebration of youth taking place in the city, and a huge party of sport and celebration. If the pandemic is still with us in the summer of 2022, it's difficult to see that those things would happen in the way we'd all ordinarily expect. But as Elizabeth has said, and you will have no doubt seen announced yesterday, there is now the possibility of at least one vaccine, and that vaccine does look promising, although it is going to take quite a while to roll the vaccine out and ensure that everybody is inoculated. But we have a little bit of time between now and the summer of 2022. So hopefully, if we can build a bridge through the current restrictions to that vaccine becoming available, and then if we can get the logistical exercise together to give the jab to all of the population, obviously starting with those who are most vulnerable and then working backwards from there, then I still remain optimistic that science will come up with a solution that will allow us to return to normal and normal living again by the time we get to the summer of 2022, and we will be able to deliver the Commonwealth Games in the way I think we'd all like to see them delivered, and we'd all expect to see them delivered, and we will get that opportunity for Birmingham to present itself on the international stage, showing what this city and its people are all about. So I remain optimistic that we still will be delivering a fantastic Commonwealth Games in the summer of 2022. And then the second question that was posed by Genius was, on a lighter note, how do you think our local football teams are doing thus far? And do you think fans will be able to return to stadiums soon? Well, I think in the question of fans, the vaccine hopefully will allow that to happen. How do I think the local teams are doing? Well, I have to admit that Aston Villa are doing exceptionally well. I watched their game on the TV against Liverpool somewhat open-mouthed, that they could win that game in the way that they did. And similarly, the recent fixture away to Arsenal, 3-0 win there, was quite exceptional. So, yeah, Villa are doing exceptionally well. I was born and grew up in the east of Birmingham, and if you know anything about this city, if you grow up in the east of Birmingham, because of the bus routes, you're inevitably a Blues fan. So I have all my life been a Blues fan, and unfortunately, I don't think the Blues are doing anywhere near as well, although they are managing to stay with a nice cushion above the relegation zone in the Championship at the moment. But I think they're going to have to up their game. It would be nice to think that they might start emulating some of the results that the Villa have had in the Premier League, and we might see Blues get up towards the promotion places in the Championship. Although, reluctant as I am to admit this as a Blues fan, I think that's looking a little unlikely this season at the moment. So that's how I think we're doing locally. But in spite of the fact that I'm a Blues fan, I do wish the Villa all the best through this season. It would be great to see them being successful. I think the city does need at least one team in the top division. If you're going to count West Bromwich Albion, which I guess one part of their ground is just inside the city boundary, you could say we've got two teams in the top division, and good luck to both of them. But I would personally love to see Blues in the Premier League as well and being successful in that division, more especially because they're the team that does carry the city's name. If anybody else wants to pose a question to any of us, but Elizabeth in particular about the pandemic, then please do put a question in the Q&A, and we'll attempt to get those answered. If nobody's posing a question at the moment, I'm going to move on to the next item on the agenda, which is local updates. First of all, from myself, I've been very aware that since the first lockdown occurred, what we have seen right across Shard End has been something of an outbreak, to coin a phrase, of fly tipping. We've seen an enormous amount of fly tipping across the ward. I've been trying to get on top of that by getting it moved as quickly as we possibly can, but ultimately we need the level of fly tipping to stop, and we need to get some behavioural change introduced in order that people stop doing this. It's not in anybody's interest to have fly tipping across the ward. It's a real nuisance. It's a health hazard, and of course it costs an enormous amount of money to go out and pick it up. So although I'm aware that it's been happening and been doing my best to ensure that it is picked up, we could really do with some behavioural change here, so people making it clear that this is not acceptable behaviour, and that whoever's doing the fly tipping should desist from doing it. And then the other couple of things I just wanted to raise, and this may be a segue into Kevin contributing as well, is that we're currently looking at a couple of schemes on the highways across Shard End to deal with a couple of problems. The first one is the issue of turning right out of Brownfield Road onto the Heathway, where the new measures that have been put in place, they're not new anymore, of course, the measures that have been put in place to prevent people parking on the grass verge have resulted in the only alternative then to park on the highway, and that is causing sight lines, particularly when you're turning right out of Brownfield Road into the Heathway, to be very, very difficult. And we're looking at a scheme that might build out that junction in order to make it easier for people in a car who's trying to turn right out of Brownfield Road onto the Heathway. We believe we've got the funding in place for that scheme, and we'd like to see that built out later this, well, probably not later this year, probably into next year now, given where we are on the calendar year. And the second highway scheme that we're looking at is on the junction of Shard End Crescent and Packington Avenue, down near the care home, where there have been a number of minor accidents that keep occurring persistently. So we're looking at a scheme where we might introduce some speed cushions to try and slow down the speed of vehicles on Packington Avenue in order to make it safer then for vehicles turning out of Shard End Crescent onto Packington Avenue. We haven't quite got the funding together for that scheme at the moment, but between myself and the highway engineer, Alan Porter, we've got some thoughts about how we might do it. And we're going to be out to consultation with local residents in that location over the next few weeks to see what they think about the idea of putting some speed cushions in there to slow traffic down and hopefully stop the series of low-level accidents that we've seen in that location. So that's what I wanted to report into the meeting this evening. Again, if anybody wants to comment on any of that, do put some comments in the Q&A. And I think I will, at that point, having spoken about highway schemes across Shard End, just pass over to Kevin and see what he wants to talk about. Kevin.
Good evening, thank you very much. So I'll keep my section nice and brief. So my name's Kevin Gibbon. I'm the highway steward working for Kia Highways on the interim services contract for Birmingham City Council. I am responsible for the inspections and maintenance of the east quadrant of the city. So any reactive maintenance works, any potholes, any tripping hazards on the footpath, they all come through me and my team, all for the east part of the city, which includes Shard End. So if anybody's got any issues that they want to raise with me that we can get somebody out to have a look at and hopefully get those fixed, then by all means, please either put it in the chat window, report it through to councillor, or report it through the Birmingham City Council's website. That's the best way to go about it. Apart from that, I'm yours to use and abuse where highway maintenance issues are found.
Thanks, Kevin. Roger from Shard End Communities. Hi, Roger. It's good to hear from you. He's posted into the Q&A asking for an update on All Saints Square and the repairs. We've been having a to and fro with the managing agent on All Saints Square to try and get those repairs done for quite some time now. So, is there an update on that?
So, All Saints Square, I assume we're talking about the car park primarily here. The issue we have with that is that it's private. It's completely under private ownership. The Birmingham Council, Kia, has no maintenance responsibility over it at all. It was, I believe that Alan Porter may be able to give us an update on that. He may have been working with that. on that. But I had a conversation with, I can't remember who it was off the top of my head. I'd have to go through the emails with regards to the footpath along Ownell Road, which we had repaired, which is in a much better condition than it was this time last year. But the car park itself, unfortunately, no, I have got no updates on that.
Okay, well, I think we need to be chasing that up then, given that Roger's reminded me that this has been going on for some time.
Yeah.
The issue, I think, is that car park was never fitted correctly in the first place in terms of drainage, and we really need to get that resolved by the current managing agent, because the situation is only going to get worse, and it's unacceptable. One of the proposals was to tarmac it over, and it's really unacceptable to tarmac it over, given that the intention in the first place was to create something that would be a little more aesthetically pleasing, given that it's a car park we're talking about, than just black tarmac being plastered over that square. So if we could, via Alan Porter, because he is in touch with the managing agent on this, we do need to chase them up yet again.
I'll pick that up.
So we'll try and do that, Rog.
I'll pick that up with Alan, and we'll come up with a plan to try and put some pressure on the developers to get that sorted. Okay, thanks, Kevin. Not seeing anything else in the Q&A, and this really is the opportunity for those of you who are attending these meetings, this meeting from Chardin, to ask any questions you want of either myself, Kevin, or Elizabeth. So I'll give you a few minutes to see if any more questions actually come in before. And actually, if anybody wants to raise any other issue, do that in the Q&A as well. Roger's put something else in there about a legal challenge. Do you mean a legal challenge, Roger, in respect of the repairs to the car park? Because if it is that, I don't think it's a legal challenge we need to post. I think we need the planners to challenge the managing agents in order to put the car park into the state that it was originally intended it should be designed to. If there are no other questions anybody wants to pose, or suggestions you might want to make about how in particular this meeting might be improved going forward, because I suspect we're going to be in the current situation for a number of weeks to come, probably going into the new year, and if we do hold another one of these meetings, I think personally I'd like it to be a little bit more interactive than this, giving the opportunity actually for others attending this meeting to be able to speak rather than have to write into the Q&A column. So between myself and Beverly Edmead, who looks after these meetings, she's the council officer who looks after these meetings, we'll try and come up with something a little more interactive for the next meeting we have. But at the moment we are stuck with putting things into the Q&A. So Roger's just confirming that yes, challenging the managing agent LCP is what we need to do. I'll take that away and have another conversation with Alan Porter on that. We will keep pushing to try and get this car park situation sorted out. And I'll give you a few seconds if anybody wants to post anything else. If not, then I think we will bring the meeting to a close. And as I say, we'll try and get to a format of this meeting when we hold the next one, which hopefully can be in January, a format which will allow others to speak, because I think that would be a little better and a little closer to the kind of situation when we were holding these meetings for real. It's just unfortunately not possible to do that at the moment, given the current restrictions. Roger's suggesting we might try Zoom next time. Yeah, that's probably the answer, actually, Rog, in terms of allowing people to speak in the meetings and
thinking about who has access to what sort of technology. Okay, if we're all done, I'm going to thank everybody for attending this meeting this evening, and thank Elizabeth for her update on COVID, and Kevin for his comments around highways this evening. If anybody wants to get in touch with me, you can get in touch with me via my email address, or indeed phoning me at the council house. I think my phone number is widely available. And could I just again thank everybody for coming along this evening. Thank those of you who've put questions into the Q&A, which we've done our best to answer. And hopefully I will see you all soon, and do keep safe in the meantime. Follow all of the guidelines and rules around the current restrictions to keep everybody safe, and hopefully we'll see you all soon. Thanks everybody for taking part this evening, and good night.